compared to some of the posters up there, it certainly wasn't as scientific as that. It was really much more about what is health, what is community development, how do we do those things and what is our calling as Christians, and
Right.
in a public, writing it for a public medical school. That's,
Yeah.
but and so a lot of the sort of bylaws and things we had to do after that, and a lot of those sort of things were kind of fleshed out, particularly with H and using Voice of Calvary's model. And I think we used probably initially, I don't know when we got a 401c3, or whether I think we initially used Voice of Calvary's as we were coming out of there. And then it was the putting together a board, kind of getting the 2 years, 82, I guess, the first conference.
So you stayed involved through all of
Yeah.
that, and
So I was actually in residency then, but then as we were putting together the board and having meetings, we would have like a board meeting with some of the early pioneers, Ray Downing and Tennessee, outside of Knoxville, and
Right.
J.D. Miller and Kentucky, and or some of the folks around the early board and involvement. It seemed initially was more as many rural as urban folks, but then
Yeah.
we got involved with the urban folks, Janelle and Ketchus in Washington, D.C., and Carolyn Klaus in Philadelphia. And
Yeah.
uh,
A lot of those people are still involved. Ray Downing eventually moved to Kenya, and he did a lot of writing. He's written several really good books, and and he lived in Kenya a long time. He died a few years ago, and gave instructions to be buried in Kenya he just loved that country, and he loved the work that he was doing. He stayed real involved with CCHF through writing when we had H&D.
Right.
And there's a lot of really excellent articles that he wrote that are still available online through our website, from that. And J.D. Miller passed away last summer, and but J.D. stayed very active. He was on the board. He helped start a couple of different clinics in rural Appalachia and eastern Kentucky, and was on faculty at the University of Kentucky Medical School for a long time. And he was at this conference last year,
Yeah.
and we're in Cincinnati right now, taping this. But so I'm sad to have missed an opportunity to get JD's story. But I think he was maybe at one of the rural conferences that you guys went to. I think that was what he told me, how he connected with you guys, that y'all were at some conference on rural medicine together or something, or rural healthcare in Atlanta or outside of Atlanta or something. So what are you doing now? You're in Salem, Oregon.
Right. So I'm a family physician, and so I spent most all of my career in either community or clinics, or so currently I'm working at for the last 10 years I've been at a tribal clinic called Grand Ronde Health and Wellness. That serves Native Americans. I also have a side job doing serving medical care for 2 county jails as well on my day off.
Yeah.
But and prior to that, I was 17 years at a community health center, and also 4 years at a migrant health center in the Salem area.
Yeah.
So,
but you're not from Oregon originally.
So I originally grew up in a small town in kind of the center of Montana, a town called Stanford. So my first degree was from Stanford, and a small town of about 500.
Yeah.
So, but I went to undergraduate at Montana State University, and that's where I started reading more of the Christian periodicals that kind of pushed my faith in those sort of questions.
People, Jim Wallace and John Mercer, some others like that. So, when did you decide you wanted to be a doctor?
I started in college actually with the engineering degree, but it was like the summer before I went to college that I made a faith commitment. Then I thought, do I really want to be an engineer? And I had questions about it, so I still did that first couple of years of all the engineering, physics, and math. But then, and I want to do something more that combines science, but is more directly involved with people. And so that's why I decided to look at as medicine instead of that, because I think engineering probably retrospect would have been fine. I like doing projects and designing stuff, but so that's when I uh, decided that maybe medicine would be better. And so for me, that meant actually doing the 5-year program at undergraduate because I had to catch up some of the coursework, and I didn't. Part of my questioning, should I do medicine or not? I actually got a job in the summers and on breaks, like Christmas break, spring break, working in a rural hospital in Havre, Montana, right by the Canadian border. So I could get back then there wasn't the whole thing of doing that to get into medical school. As part of that was answering my own question, well, what does medicine mean? What's going to look like? So for me, that was getting some experience to see, is this something I want to do? And
And it stuck.
it stuck. Yeah.
Yeah.
So
You wouldn't have had your public health elective if you'd have gone into engineering. Yeah, no, yeah, for sure. There would be no CCHF probably, you know, so I'm grateful that, for lots of reasons that you chose to go into medicine. And then you did residency, maybe was that in
my residency was in Colorado.
Colorado?
Yeah. And so that was just, when I went to Mississippi the first time I had been on a residency trip, interviewing. So I had a list of residencies they thought were good residencies from our, family medicine department. And so it was one of the ones I interviewed in that I matched. And so retrospectively, if I'd known more about Mississippi and the possibility of being there, I may have looked at that. I mean,
Yeah.
at that time, there were really no Christian health centers or residents associated with them like there is now. And so there was really, of course, again, no internet or emails or things where you can connect with folks. It was much more trying to figure out what was available. And
yeah. And so residency in Colorado, you had this connection in Mississippi. How'd you get to Oregon?
So to pay for medical school, I took a National Health Service Corps scholarship.
Okay.
And so, and I looked at the option of whether I could do that in Mississippi, but New Hebron, which had started, but then didn't need any physicians. And the other clinic, they were just getting started in Jackson, didn't have because maybe Jackson didn't qualify as a health manpower shortage area, didn't have funding for the National Health Service Corps scholar. And so I ended up going back to the Northwest and ended up serving in a migrant clinic there. So I did that for 2 years initially, and then decided I needed to learn Spanish. So I went to Mexico and learned Spanish.
No need.
And then I actually spent a year working with Salvadoran refugees with Church of the Savior with Washington, D.C. with
Dr. Getchus.
Yeah, and then went back to the migrant clinic I was at.
Yeah.
And then ended up leaving there and going to Cambodia for a year with the NI Central Committee.
Oh, okay.
So I always had the desire to do something overseas, and it came up, and I thought I would go do that. So
yeah, well, you're settled in and working with the travel clinic now, and I want to come back to that in a minute. But let's talk a little bit about like early days in CCHF. So you started CCHF. It was it sounds to me like, see if I'm getting this right, but it was at the time, it was probably mostly about a newsletter that was, or a journal or something that was going to go out. And you started with the Voice of Calvary mailing list, which basically was the John Perkins fan club.
Sort of. Well, particularly the people who had written into them or were interested in what they were doing in healthcare. So particularly targeting those folks.
Yeah.
And I'm sure H had, connections with folks also that he used, and coming back exactly how the connection came up with, for instance, Janelle in DC.
Yeah. So how did things develop into sort of this sort of network of clinics? And I mean, the fact that you guys called it Christian Community Health Fellowship, you had something in mind. You kind of envisioned a community. I would sometimes.
Yeah, I think envisioning that community was both a community that would support one another as far as with folks involved in healthcare as a ministry, but also the sense of the church's community that that could be part of what the church is doing as part of development as well.
Yeah.
Particularly, I think, as far as the model of the Voice of Calvary was trying to do, and they're both having health center in Jackson and one in New Hebron. And there are other health centers that have kind of followed that model, like Lawndale and Chicago.
And somewhere in all that early days, you and H visited the clinic that was up in the Mississippi Delta. That was a Christian clinic.
Right, and that was actually when I first went to Mississippi for that month. We went and visited Peter Bolins at Cary Christian Clinic in the Delta, and talked with him about his experience. And
he had written a little book. Did you read that book, Delta Doctor or something like that? It was published through the Luke Society.
Yeah.
I've met a lot of people who were inspired by that book, many, many years ago that decided, hey, this is kind of the kind of medicine I want to do and that kind of thing. So what was it? What'd you learn at Cary? What'd you see? What'd you learn? What was that like?